Hi, I'm Richard Savino. I'm the Chief of Orthopedics at NYU Langone Hospital Suffolk. Predominantly a sports and adult reconstruction surgeon. I do total hips, knees, and shoulders. I decided to become an orthopedic surgeon after having multiple injuries as a child and being quite disabled by going to see orthopedic surgeons and ultimately having orthopedic surgery. I went from disabled to actually performing at a very high level, and going through the entire process, I realized that it was a really good way to treat and help people. I'm born and bred on Long Island, that I've lived here most of my life, but I did have the opportunity to travel and train, all throughout the Eastern Seaboard, and have been to many countries teaching orthopedic surgery on medical missions. And every time I come back to Long Island, I know it's home. I've been in practice for more than 25 years. I personally tailor my treatment of patients based on interviewing the patient, talking to the patient, getting to know the patient, figuring out how their malady is affecting them, and then trying to develop a treatment plan custom tailored for them. It's not a cookie cutter approach. You want to get people back to what they want to do, enjoying life as fast as possible. Being the chief of the service as well, I have hundreds of orthopedic doctors at my disposal to direct patients, act as sort of a gatekeeper to make sure that if I'm not the right individual to do their surgery or to treat their particular problem, that I can get them where they need to go. A lot of people have reluctance to see a surgeon initially because they feel like they're going to be pushed into surgery. That most of the time they're not getting signed up for surgery. They're going for physical therapy, or we're doing injections, or a number of things to try to get them back with as little time out of work or down as possible. And we try to keep patients out of the operating room unless it's something that they really need. And only then, after we've exhausted most of the conservative options, would we go on to ultimately doing an invasive procedure. Extremely proud to be part of NYU Langone Hospital Suffolk's family and offer the patients in Suffolk County and even Nassau County the world-class orthopedic care that they deserve without having to go to Manhattan.